I'm Dr. Hakim, the chairman of American Spine Center. At our center, we avoid surgery at all costs. Why is that? Because our non-surgical protocol gives success rate of 91%. What we use, our 360-degree treatment plan, that will be consist of, one is we're using stem cell therapy that help to repair the disc and decrease the inflammation, and that's so crucial, and that control the patient condition. Also, we use a technology called IDD technology, that intradiscal decompression. What does it do? It creates negative intradiscal pressure that help the disc to retract inside and also hydrate the disc and help to recover the injured disc. Also, we give the patients lifelong exercise they need to do, along with what we call to see if they have risk factor, predominantly if the patient is overweight or the problem have with sitting posture, that's very common we see, also vitamin D deficiency, and definitely smoking. When we have a problem with food posture or overweight, the disc always contracted all the time. Add to that, if we are a smoker, these blood vessels are closing in the smoking because of atherosclerosis. So what happens? This become fragile, weak. So any pressure on the disc with wrong move, or even in the gym, the disc will go ahead and just rupture and go outside and push on the nerve. And that is the problem we have with people what we call multiple risk factors. That's why smoking is no for people who have back problem or disc herniation. So we always try to put the patient on smoking cessation program, which is very successful as long as the patient are willing to stop smoking. Again, our percentage of success, 91% at American Spine Center, non-surgical. Welcome to see you at our center and explain to you our treatment strategy. Thank you.
Hi everyone, I'm Dr. Nader, a dedicated pain and medicine specialist at the American Spine Center. Chronic pain, in definition, is pain that lasts more than 3 months. But every pain that interferes with the normal lifestyle or interferes with the sleep of the patient or stop the patient from the normal activity, we call it chronic pain, and the pain in this degree, we should treat it and we should admit this patient. The most important point that you should know is that tolerating the pain is not treating the pain. If you have any pain, you should go forward for treating your pain, because every acute pain that not be treated makes chronic pain. If you or somebody you know is struggling with chronic pain, don't hesitate to contact us. Please visit our website or Instagram or call us to make a schedule for consultation. Our clinic provides you a comfortable and advanced setting to ensuring you receive the best care possible. You deserve a life without pain. Let's work together towards a pain-free life.
Let me explain to you why you have a neck pain. First of all, I like to see those muscles that you have multi-layers that hold your neck straight forward, and you have really strong muscle. Then you have your vertebrae that make your spine move different direction, and you have your spinal cord. This is the most important organ in your body. What happens if you have a disc here, that's really where your pain coming from, make it inflammation. This inflammation shoot down to your arm with the numbness tingling, cause to have pain in the neck and headache, and that's your problem is really arising from this. The treatment for this is really very easy. We have cure for that with no surgical approach.
Hello everyone, my name is Professor Mohammed Al-Jumaili, consultant neurosurgeon at the American Spine Center. Today we're going to talk about the effect of neck pain on headaches and migraine. Neck pain usually causes degeneration of the neck, and the neck will be tilted forward. When the neck tilts forward, we will have stretching of the nerves that go up into our head. Once these nerves are stretched, we get headaches and migraine. To prevent these headaches and migraine that happen due to neck pain, we prevent bending our neck. So basically, we use our mobile phones in front of us like this as opposed to below us, and that could cause neck pain. In addition to that, we use the desktop or the laptop in front of our eyes to make sure that we don't bend our necks. We can also do swimming, especially breaststroke swimming, to help us maintain a good posture of the neck. If you have any concerns or questions regarding your neck pain or headaches or migraine, please do not hesitate to contact us at the American Spine Center, where we'll be very happy to help you.
Posture is not just about how we look. It's about how the nervous system communicates with the body. Poor posture disrupts the natural alignment of the spine, compressing nerves, limiting blood flow, and altering proprioceptive feedback to the brain. Over time, this misalignment can trigger headaches, muscle fatigue, and even changes in mood and focus. The brain continuously adapts to how we position ourselves, so a chronically slouched posture can literally rewire the way we feel and move. As a neurologist, I see posture as a silent language between the brain and the body. Train it with awareness, because every movement you make is a message your brain will remember.
Hello everyone, my name is Dr. Danny Shawaf. I'm a consultant vascular surgeon, and part of my specialty is treating patients with varicose veins. Varicose veins is a very common disease affecting many patients. It is actually an abnormal dilatation of the veins. Varicose veins can cause leg pain, leg swelling, leg cramps, and many other symptoms. So it's not something strictly cosmetic. Treating varicose veins is very important. The treatment is not strictly something surgical. It can be also non-surgical. And there are so many ways we can treat varicose veins without surgery. For example, injections, or what is known as sclerotherapy. So if you do have varicose veins or you do have any of these symptoms, please don't hesitate to contact the American Spine Center for your consultation.
IDD stands for Intervertebral Differential Dynamics. It is the decompression machine for the spine. It can be used for the lumbar and the cervical spine. It is a customized program, and the force can be delivered exactly on the level of the injury. The decompression helps in reducing the pressure on the spine, mainly used for disc herniation, the bulging of the disc patients. It's a non-surgical and non-invasive program protocol. We combine the decompression session with the manual therapy, electrical therapy as well. As you can see, there is a blue line and a red line. The blue line stands for the target tension, and for the red line is the actual tension received by the patient. This helps in bringing in more nutrients and blood supply to the disc. This also helps in improving the posture of the patient. With the number of sessions, around 15 to 20 sessions, the recovery can be seen on MRI as well. If you are experiencing back pain, no need to wait more. You can please visit American Spine Center and have this comprehensive treatment for yourself. Thank you.
Vitamin D isn't just for your bones. It plays a critical role in brain health and immune regulation. Low levels have been linked to depression, fatigue, cognitive decline, and even increased risk of neurodegenerative diseases. Your body makes it through sunlight, but deficiency is incredibly common, especially in people with limited sun exposure, darker skin, or chronic illness. Neurologically, vitamin D acts more like a hormone. It modulates inflammation, protects neurons, and supports neurotransmitter function. The takeaway? Don't wait for symptoms. Check your levels, especially if you're dealing with brain fog, low mood, or fatigue. It's a small molecule with a big neurological impact.
Today we'd like to talk about Mounjaro. Mounjaro injections used to treat type 2 diabetes, but recently been approved by the FDA for the treatment of weight loss. It's injections, we give it weekly, and we increase the dose every 4 weeks. There are some certain group of people with a family history or a personal history of certain type of thyroid cancer. We do not recommend to initiate Mounjaro to them. Most of the common side effects that we see after an injection of Mounjaro are headache, nausea, and general fatigue. And it is always recommended when we want to stop the Mounjaro injections is to stop it slowly and taper it off weekly and tapering the dose off. And thank you for listening and wish you good health.
Microplastics are not just an environmental concern, they're becoming a neurological one. These tiny particles can cross biological barriers, including the blood-brain barrier, entering delicate neural tissue. Once inside, they trigger inflammation, oxidative stress, and subtle disruptions in synaptic communication, the very connections responsible for memory and cognition. Emerging research suggests a link between chronic microplastic exposure and early cognitive decline. It's a silent threat, invisible but capable of reshaping how the brain processes and remembers information. As a neurologist, I believe protecting brain health today means also protecting our environment, because every particle that pollutes the planet may eventually find its way into the circuits of the mind.
Doctor,
Hey,
why does
hi.
it say danger here?
Okay, because this machine is an MRI. MRI stands for magnetic resonance imaging, meaning to say that this machine uses a high field magnet. It is a very strong magnet. Only people who are allowed to go in are patients who have to remove all the metals. As you can see, there is a restriction here telling you that you have to remove everything metal. That includes your ATM, your watches, any keys or anything instrument that is highly magnetic is not allowed inside.
Osteoporosis isn't just a bone issue, it's a neurological concern too. As bones weaken, the risk of spinal fractures increases. These can compress nerves, cause chronic pain, and reduce mobility, especially in older adults. The most dangerous consequence, a hip fracture? It can double mortality risk within a year and often leads to long-term cognitive and functional decline. It's more common in women post-menopause, but men aren't immune. Prevention starts early: calcium, vitamin D, weight-bearing exercise, and screening after age 50. Remember, strong bones protect more than posture, they protect the nervous system too. Posture is not just about how we look, it's about how the nervous system communicates with the body. Poor posture disrupts the natural alignment of the spine, compressing nerves, limiting blood flow, and altering proprioceptive feedback to the brain. Over time, this misalignment can trigger headaches, muscle fatigue, and even changes in mood and focus. The brain continuously adapts to how we position ourselves, so a chronically slouched posture can literally rewire the way we feel and move. As a neurologist, I see posture as a silent language between the brain and the body. Train it with awareness, because every movement you make is a message your brain will remember.
Doctor, hi. Doctor, how are you?
Oh, hi. Thank
Doctor, I have a
you.
question. Why do we
Yes.
have these red lines and these green lines here?
Oh,
What's the
this
reason for
green
that?
line is like, it differentiate between the sterile zone, green and red. Green line means the patient can come over in their normal clothes. But the red should not be crossed. It should be only crossed with an authorized personnel with the scrub suit and the proper attire of the OT.
Hello, my name is Dr. Mohammed Shaukat. I'm a board certified family medicine specialist at American Spine Center. We provide non surgical treatment for spine and joint disorders, and also we deal with acute and chronic conditions. Today, I'd like to talk about osteoporosis. It's a chronic condition that affects the bone density, decreases bone mass, and can increase the risk of bone fractures. We start screening for osteoporosis for everyone at the age of 65 or below this age if a person having some certain risk factors by a test which is called DEXA scan. Risk factors for osteoporosis may include female gender, old age, people who are using some certain medications like corticosteroids, antidepressants, medications for stomach acidity, and anti-epileptic medications. Prevention of osteoporosis will include improved diet by increasing vitamin D and calcium-rich supplements and foods that are rich in vitamin D, like green leafy vegetables, fish like sardines and salmon, and low-fat dairy products. Also, we need to limit alcohol intake and stop smoking. If you have any questions or any queries about osteoporosis or any other chronic condition, please feel free to visit us at American Spine Center.
Let's start by defining what is scoliosis. Scoliosis is a lateral S or C shape of the curvature of the spine. And here are some exercises you can do if you have scoliosis. Number one exercise is pelvic tilt exercise, which will help you with building muscles in the shoulder and the back while maintaining good posture. And the second exercise will be sitting rotation stretch. This exercise can help you build and maintain core strength to support the spine. And if you want to know more, get in touch with us in American Spine Center.
This is a good treatment for sport injury, osteoarthritic joint, and the back pain or not. Yes, it is good. But you must have high concentration of the plasma. Not all type of plasma is effective in this type of treatment. It is good for the back as an epidural injection. Also, it is good for osteoarthritis of the joint in grade 1 and 2 and 3. And it is perfect in treatment of sport injury, ligament injury, or soft tissue injury. It have the higher effect regarding to be high concentration.
Varicose veins is a very common disease affecting both men and women. Although women are more susceptible to getting varicose veins due to the female hormones and for the pregnancy, which is actually a risk factor for varicose veins. The symptoms for varicose veins, they vary from one patient to other. Most patients complain of painful veins on the surface of the skin in the legs. Others complain of swelling, heavy legs, leg cramps. Leg cramps is actually one of the symptoms for varicose veins. They vary from one patient to other, but most patients complain of painful visible veins on the skin of the legs. Others complain of swelling, heavy legs, or maybe leg cramps. The treatment for the varicose veins is actually done after proper diagnostic for the varicose veins. So once we have done the proper diagnostics, then we know what kind of problem the patient has, and based on that we will set the proper treatment. This can be a simple treatment method with like what we call conservative management, including wearing stockings, changing some daily habits and others. And sometimes it can the proper treatment can be surgical or minor surgical procedure. In a lot of cases, it is done with sclerotherapy, which is injection treatment, injecting the veins with special medication. This is done in the clinic. It is usually not painful with really good results. And hope you always stay well.
Sleep is far more than just rest. It's a complex neurological process that keeps the brain in balance. During deep sleep, neural networks reorganize, toxins are cleared, and memory is consolidated. But when sleep becomes fragmented or shortened, these critical processes fail. We start to see changes in attention, emotion regulation, and even structural brain integrity. Chronic sleep disturbance can heighten the risk of depression, cognitive decline, and neurodegenerative disorders like Alzheimer's. As a neurologist, I see sleep as the most accessible form of brain care, a natural therapy we too often neglect. Protect your sleep, because in every quiet night, the brain is rebuilding the very circuits that make you who you are.